Good afternoon. The Committee on Education is now in session. Today's date is September the 8th, 2021. The time is approximately 2 o'clock p.m. and we are in conference room 329 and locations from across the islands. The committee thought it would be particularly prudent to hold an informational briefing, especially now. In Hawaii and across the country, schools are now reopened and students are back in the classrooms after quite a bit of time away because of COVID. Except unfortunately, also because of COVID, we know that still there's an array of challenges that continue to persist and that we are now facing this new Delta variant that is much more transmissible than any of its predecessors. We also know that it's penetrating into younger populations. And according to a recent report, 1 out of every 4 new cases is found in a child. This represents a 200% increase from just 5 weeks ago. And so we understand that as cases continue to spike because of this new Delta variant, that this is the backdrop that we all are facing, and this is our new reality. I believe that it will take all of our collective efforts to make sure that we make things better, not only broadly speaking, but specifically as it relates to our public schools. And so today we have with us today the new interim superintendent, Mr. Keith Hayashi, formerly principal at Waipahu High School. We know Mr. Hayashi, he's done some amazing work there at Waipahu High, and we hope that that will translate into some system-wide adjustments. But before we can do that, we have to focus on safety, health, and learning. And specifically, we are discussing today issues that have been brought to all of our attention through our fellow members, our community members. And so without further delay, Mr. Hayashi, the floor is yours.
Aloha, Chair Woodson. Aloha, Chair Woodson, Vice Chair Kapela, members of the House Committee of Education and House Representatives. I'm Keith Hayashi, Interim Superintendent. With me today is my Deputy Superintendent, Phyllis Unibasami. Thank you for the opportunity to share with you an update on the opening of school year 21-22. Let's see, next slide, please. Okay, please turn to slide 2 in your packet. The committee requested an update on the following areas: mitigating the risk of COVID-19, including mitigation strategies such as masking and social distancing, efforts to increase distance learning capacity, expansion of on-campus testing opportunities, and efforts to address bus driver shortages impacting school bus routes.
Mr. Hayashi,
Yes.
are you going to be providing the slides for the edification of those who are watching?
Yes, I believe they're in chat. Nanea Kalani is, I believe, trying to get in. She's the Interim Communications Director, and she has those slides available. I'm sorry if you didn't have that. Can she be let into the meeting so she can share the slides?
Yeah, we'll take a quick pause to make sure
Okay.
that we have the slides available.
Thank you.
Quick recess.
Okay.
Serious screen.
Because she's not in the chat.
Okay, thank you. We're back from recess, so we have the slide deck up and available, and hopefully everyone can see it. Superintendent, please continue. Thank you.
Thank you, Chair Woodson. May I have slide 2, please? Thank you. The committee requested an update of the following areas. Again, mitigating the risk of COVID-19, including mitigation strategies such as masking and social distancing, efforts to increase distance learning capacity, expansion of on-campus testing opportunities, and efforts to address bus driver shortages impacting bus routes. Slide 3 shows what we are doing to mitigate the risk of COVID-19 in our schools. The department regularly communicates with the Department of Health to stay up to date with the latest information and COVID-19 prevention strategies. As the Department of Health's guidance is updated, we update our COVID-19 health and safety guidance for the field. This document is available on our website as a reference for our schools, employees, and communities. The Department of Health says core essential strategies are so effective that in-person education always requires these strategies be implemented. We continue to practice the core mitigation strategies, encouraging vaccinations, staying home when sick, consistent and correct mask wearing, and proper hand hygiene. Other strategies, such as designated cohorts, improving ventilation, physical distancing, screening, testing, and cleaning and disinfection, should be applied in a combination to the greatest extent possible. Physical distancing, according to the Department of Health, is not listed as a core essential strategy because physical distancing of at least 3 feet is not practical in all school settings. Using multiple mitigation measures consistently and in combination gives schools the flexibility to achieve safe learning environments, even when not every mitigation measure can be applied. While schools continue to have cases and health and safety practices that our schools implement are proving to be effective at quickly identifying cases and preventing spread. For the next slide, turning it over to Deputy Superintendent Unibasami.
Sorry, I was struggling with my mute button. Aloha, everyone. So this is slide 4. And this is about distance learning. So slide 4 gives an overview of our distance learning options. And while the majority of our students are back in school in person, we do have some students who are participating in distance learning. The student's parents and the school administrator work together to determine if distance learning is the best option for the student. Distance learning options may be offered at the school, the complex area, and the state level, depending on the schools or the complex area's capacity to offer such programs. Distance learning programs may be synchronous or asynchronous, with or without an online curricular program, and depending on the availability of teachers. Whether the class is synchronous or asynchronous, there is a teacher of record for monitoring and grading. Should a complex area not be able to accommodate a student for distance learning, the Office of Curriculum and Instruction Design has developed a distance learning program. We are currently working on a solution for Kaipuni students given family requests for distance learning. The state distance learning program for grades K to 12 in synchronous and asynchronous, and our enrollment for this program is 625 K to 12 students with no waiting list as of this week. For grades K to 8, the K-12 Stride Learning Solutions online program will be the primary instructional program with a teacher assigned to support the learning. For high school, students will have 6 courses in order to earn the 6 credits to matriculate to the next grade level. As with our schools in complex areas, the state program currently has limited capacity due to staffing. Because our focus on bringing all of our students back on campuses this school year for in-person learning, distance learning options across the state is limited. On slide 5, The department has partnered with the Department of Health to coordinate the school-based COVID testing for eligible students, for staff, and for school communities at no cost. There are currently 2 options available to school: the epidemiology and laboratory capacity, which is termed ELC, and Operation Expanded Testing, OET, schools. Schools are currently in the process of registering for these opportunities and training their staff. Once established, testing will be available to any student, staff, or household member that provides the required consent. Test schedules will be at the school's discretion. Expanded testing opportunities will also provide convenient access for staff as part of the department's testing mandate. To comply with Governor Ige's vaccination and testing requirements, the department implemented a weekly testing requirement to help ensure our schools and offices are safe for students and staff. Our numbers show 89% of active salary HIDOE employees are fully or partially vaccinated. The testing requirement has resulted in some staff absences and at some schools, but principals have been able to cover the position with other personnel. Handing the presentation back to Superintendent Hayashi.
Thank you. The department continues to experience a severe shortage of student bus drivers statewide. We are on slide 6, I'm sorry. The shortage is causing limitations in transporting students to and from schools. Our immediate challenges are on Maui, Oahu, and Hawai'i Island. As you can imagine, the shortage is related to the impacts of COVID-19. Overall, there are national and local driver shortages. Former drivers finding other employment due to the extended time out of work, and staffing gaps caused by drivers needing to isolate or quarantine. In some areas, transportation will be limited and could be suspended in the next few weeks until drivers return to work or replacement drivers are certified. A parent letter went out on September 1st to families on Oahu, Maui, and Hawai'i Island whose children are eligible for student transportation services. The letter let parents know that for planning purposes, families may need to find alternative transportation to and from school in the coming weeks. As the department manages staffing and works to consolidate routes, priority will be given to special education students. At this time, we do not know which bus routes will be impacted as conditions are changing rapidly. The department stood up a website and is providing updates on impacted routes. West Hawaii in particular has been experiencing a severe shortage of drivers, which has resulted in a substantial consolidation of routes. The department is working to secure Hele-on bus passes for families that are interested. The Student Transportation Services branch will also be offering mileage reimbursement in the event families who qualify for transportation are unable to get bus service. The application and voucher form can be accessed from our website. Next slide, please. Oh, slide 7. Our schools have done a great job in welcoming our students back to our campus, and we look forward to sharing our successes in future briefings and updating the legislature and the public on our efforts. Again, prioritizing in-person learning and ensuring our schools are safe will take all of us working together. We are in a pandemic, and there's a lot of misinformation out there. Accuracy is so critical right now. To help provide accurate and timely information to families and the public, the department recently developed and launched a dashboard on our website that displays confirmed COVID cases in the DOE schools and offices. The data is updated regularly, daily. It is clear that the increased level of transmission seen in the broader community is not reflected in our schools. There continues to be no evidence of large clusters in our schools because of the mitigation strategies that we are enforcing. Nonetheless, the department continues to work closely with the State Department of Health in monitoring the impact on our schools. Another area where misinformation is being spread is around instruction of students having to isolate or quarantine. Remote learning for students who are unable to attend school in order to meet quarantine requirements includes makeup work to keep students on track. This is consistent across schools. The instructional model for delivery, however, varies by school. The options include, for example, assignments via Google Classroom, Blackboard, paperwork packets or online programs, and virtually joining a classroom via Google Meets with the chat feature turned off so that teachers are not simultaneously teaching in person and remote students. Again, thank you for your continued support. Standing by for questions along with Deputy Superintendent and I, our Assistant Superintendents Heidi Armstrong, Sean Bacon, Brian Hallett, Christine Shaw, Randall Tanaka, Carol Tanimura, and Terry Ushijima. Thank you very much.
Thank you very much, Superintendent. So now we're going to open it up for questions. The members have been told prior to this informational briefing that they will have the opportunity to ask at least 2 questions. And we wanted to afford everyone that chance because we know that there's a lot of questions that are coming from all of our community members. And so first up we have is Representative Quinlan with a question about sanitation. Rep. Quinlan.
Thank you, Chair. Thank you, Vice Chair. Thank you, Superintendent, for being here. So I've had a number of inquiries recently about a lack of room cleaning and/or COVID-related sanitization in classrooms, and that's both Central and Windward District. In fact, it's gotten so bad that one of my principals is going around emptying out the trash cans every night. I'm wondering, have you heard of this? Are you aware of this? Is this a systemic issue? And could you talk a little bit about the process of hiring, because I believe it's room cleaners and not custodial staff for the individual classrooms, but maybe you could speak to that. Thank you.
Thank you, Representative Quinlan. For that question, I'm going to ask Assistant Superintendent Randall Tanaka or Assistant Superintendent Sean Bacon to please respond to Representative Quinlan's question. Thank you.
Hello, Rep. Quinlan, Randy Tanaka here. Thank you very much for your time and your question. For the most part, it hasn't been reported to our division on shortages. A lot of the custodial work is handled at the school level and reports to the principal, but it would be most helpful if you can identify or encourage them to call us directly, and we'll try to address the issue on a case-by-case basis. But I have not heard of shortages in terms of custodial work in the classroom.
Okay, well, I'll hook up with you after this and we can talk about some specifics maybe.
Great, thank you.
Thanks very much, and thank you, Chair.
Thank you, Representative. Majority Leader Bellotti.
Thank you, Chair. Dr. Fauci just recently stated that one of the best ways to protect our unvaccinated population, i.e. that group under 12 years old who cannot receive a vaccination, is for the adults around them to be vaccinated. That's a key way to protect our elementary school kids. So on that note, if 89% of DOE employees are vaccinated or partially vaccinated, what is the aggregate number of unvaccinated employees? Are there larger numbers of unvaccinated employees in particular complexes? And has the testing programs, either ELC or OET, been quickly stood up in those complex areas? Because I'm hearing that the testing is delayed in being stood up. Thank you, Chair.
Thank you, Representative Bellotti, for that question. I'm going to ask Assistant Superintendent Sean Bacon to please address Representative's question, and if Deputy Unibasame would like to also speak to the testing. Thank you.
Good afternoon, Representative Bellotti. This is Sean Bacon, Assistant Superintendent for Office of Talent Management. We have been looking at the data. The data that we pulled most recently was as of August 31st, 2021. That right now, we did disaggregate it by complex area, depending on where our vaccination rates are. The vaccination rates for our employees as an average is 89% right now for our salaried employees. It does range from complex area from 75% vaccinated to 95% vaccinated at this point. So if we do actually break it out by teachers that are actually vaccinated in the classrooms, the vaccination rate goes from anywhere from 79% to 95% the vaccination rate based on complex area. I will turn it over to Deputy Unibasami to talk a little bit more about the testing opportunities.
Representative Biladi, just checking, does that answer your question around vaccination? Do you want to follow up and then?
Quick follow-up. So can you give me an aggregate number of unvaccinated employees? I appreciate the percentages, but what is the unvaccinated aggregate number?
So currently right now we have 21,980 salaried employees. Of those 21,980 salaried active employees, 19,559 are vaccinated.
Okay, thank you. That answers that part of the question. Thank you.
And if I did my math correctly, sorry, it's 2,421. Somebody might want to check my math, but I just did. Sean gave us that data this morning. So I just minus the total number of salaried employees from those that are vaccinated.
And I just want to confirm, these are people that have both shots, or they are in the series and have had at least one shot and are working on getting their second shot.
Representative, does that answer your question?
I think it does. And in terms of identifying the complex areas, we don't need to do that now, but I think the focus should be then, if we know if there's larger concentrations of unvaccinated, certainly those are the same places we want to be sure to be getting out the message that vaccinations is a key way to protect our unvaccinated population.
Representative, totally agree with that. We had an early morning meeting with DOH last week on outreach and communication and really targeting areas where we see high rates of community transmission and also low rates of vaccination. In that, really talking about ways in which to reach the communities, to share information with the understanding, with the agreement that it was not to bring shame or to in any way diminish their dignity, but to with the hopes that by providing information and access, that it would also increase the confidence and comfortableness in getting the vaccination. So we have a packaged approach of doing some outreach, answering questions, perhaps bringing in speakers, trusted members of the community that people will recognize, talking about the vaccination, answering questions, and then later down the line doing a testing and vaccination effort in the community.
Thank you, Majority Leader. And we'll certainly take a collective effort. Next, we have Representative Ganaden.
Hi, Director, and thank you so much for being here today. I'm hearing from folks that most of the contact tracing that is required is being done by school administrators and not by the Department of Health. I'm not sure if that's true. And if it is, I'd like to understand what triggers a school to contact the Department of Health to request additional assistance in contact tracing.
Thank you, Representative Ganaden, for that question. We are making a distinction between contact tracing and close contact communication with parents. So when a student is identified, or a teacher, an adult, an employee, is identified as COVID positive, principals, what they're doing is they're completing the necessary documentation to report both to the to State Office DOE, as well as to the Department of Health. They are also then identifying those individuals who are close contact, following DOE guidance from the Department of Health. Once those students or employees are identified, principals are notifying the parents of those students that they would then need to quarantine. And what we're calling that is the close contact communication, which is different from the contact tracing that the Department of Health does. And the difference for us is we're looking at it as once that student's identified, and that name's sent to Department of Health, then their contact tracers then go back and identify where that student has been over time. And so that's what they've been. So there's a distinction between the contact tracing and close contact communication within the schools.
The Department of Health at the outset, and then they're kind of doing what they ordinarily do with contact tracing, but you're doing sort of extra work.
No, we're making sure that those individuals in the schools that are close contacts are being notified, the parents are being notified, so that students would need to quarantine up to 10 days, depending on the situation. The schools also may notify the Department of Health if there are any concerns. DOH has been very supportive for us in working together to do the best that they can, I believe, under the current circumstances. So for us in the schools, we are doing close contact communication with parents versus the contact tracing.
Can I do one quick follow-up question?
Go ahead.
Regarding contacting the Department of Health, do you contact the Department of Health if you think there's a cluster or a possible transmission on campus? So who in the department or who in a particular school decides if the Department of Health is called? Is there a policy?
No, currently the Department of Health is, my understanding is that they are working together with us to monitor whether there are clusters or not. Principals, if they do have questions, they can work with their CAS or let us know. But currently, as we're looking at the numbers in the schools, what we're seeing is that it seems to be COVID positive cases that are from the community that are appearing in our schools versus spread or clustering within the schools. Deputy, would you like to add anything else to that?
Yes, thank you, Keith. So our COVID response procedure includes notification not only to the state level COVID response team, but also to DOH. And there is an automated process that once the school reports it, and they report every case, that there is a mechanism for it to not only come to us, but also to go to the Department of Health. That's the way that we are able to collect the information, the data that we have. We don't determine clusters ourselves because we don't have the medical expertise for it. However, we are aware of what either the CSTE, the national organization, considers as a cluster, and also what DOH through their cluster report on their website determines is a cluster. So we leave it in their hands because it's through the contact tracing that they do, that they look for cases in which it happened in a particular pace with a percentage of people who are affected, and that there was no other reasonable explanation for these folks to be ill other than being in the vicinity or the area of getting the COVID virus. And so I don't know very much about it. I just know that when I read about what cluster means, those are the things that they're looking at to help us know whether or not there's a cluster in the school or not. Thank you.
Mrs. Udabisami, maybe you can also articulate what the general process is for once there's a suspected COVID case per a student, like the student is showing COVID signs. What is the protocol for that?
So the and I'm going to ask also AS Heidi Armstrong to join me on this one because I may forget some of the steps. But basically, and I'm going to talk about students or an adult in the school. And sometimes the notification will come to the school even via the family member who may call the school and say that someone in their household has is a confirmed case. In that, on any day, we ask that parents of students or employees on themselves do a daily wellness check. And that daily wellness check is very important, that if you're not feeling well, that you stay home. If you're exhibiting any signs of what are symptoms of COVID, that you stay home as a mitigation strategy. When we do have a confirmed case on the campus, we automatically look at the day the symptoms appear, and we backtrack 2 days. What was happening 2 days before for that individual, if that person is on campus, because we know that the symptoms do not necessarily appear on the day that you contract COVID. It actually, the symptoms appear later. And so we have an automatic backtrack 2 days and what was happening then. We then have the school take a look at who might be close contacts given the activities of the individual. And then they fill out some forms, and they're automated so that once they fill it out and they send it out, it actually goes to all the people that need to be informed, including the COVID response team and the Department of Health. With the COVID response team, if there are need for sanitization, then we actually have someone who then works with the school to set up what rooms need to be cleaned and when to do it. And we usually do it within the 24 hours of being told. We leave that up to the school to tell us, because they know when they want that room clean. And then we have the professional cleaners show up. Heidi, did I miss anything, or is there anything that you need to correct?
No, I think you did it. And just in summary, we determine if the individual was on campus during the infectious period. And like the deputy said, the school then sends an email to the COVID-19 response team. The schools identify and notify the close contacts that were around that student. They also initiate a call if cleaning and disinfecting is needed. The Department of Health is contacted and given the information about the case, and there's a form with fields that the school fills in. The school also completes a COVID intake form and prepares broad school notification regarding the particular case. The last step would be to determine when it's safe for the employee and or the students to return to their work site, and the school follows this return to school work criteria. So exactly what Deputy said, I just gave a quick summary.
In 10 seconds, what is the protocol as it relates to the student? Where does the student go if they're expected of having COVID? In 10 seconds.
To the isolation room. Every school has an isolation room, and it's not necessarily a room. It might be an outdoor space, but it's also an area where they can contain and make sure that the student is safe and also the others are safe.
Thank you so much. Next, we have Representative Tarnas, followed by Representative Lowen. Rep. Tarnas.
Thank you, Chair, and thank you to the Department of Education team for being with us today. This is really important for our community to hear what are your plans. My district is a very rural district, and we do not have county bus service very frequently. And I think that's a common issue in rural parts of our state, certainly on Hawai'i Island. And so your alternative plans for bus transportation with this shortage of bus drivers is, I think, if you can't really rely on the county bus system, at least on our island. And so you're going to need to really have something in place to help parents of students who depend on the bus to figure out how to do carpooling. And if you could explain to me sort of what is the process that each principal is going to go through to work with their parents to figure out how to set up these carpools, and what is the process for mileage reimbursement? I mean, it's going to be helpful because a lot of our families are on, very, very limited income, and that cost of gas is going to be important. So could you explain to us, or what will be the process for each school to help the parents figure out alternative bus transportation when county buses are not a possibility. Thank you.
Thank you, Representative Tarnas. I see Assistant Superintendent Tanaka is on, so I'll turn it over to him. Yes, Tanaka.
Hello, Rep. Tarnas. Good to see you again. What you have described is a monumental challenge for us, especially on Hawaii Island, given the distances between our schools and our communities. Three things that we put into place as this problem began to grow on us. Before school started, we got an indication that we would be short drivers, primarily because folks have went out and found other employment because they need to sustain their pay and their funds. So we began to have discussions with our contractors on Hawaii Island. So one, initiating that discussions. Secondly, as we began to find out what routes were short on drivers, we talked to them again and we looked at options of bringing drivers from outside of Hawaii Island or from Hilo to transfer over, knowing full well that we need to protect the special ed transport first and foremost. Third thing we did is we went about talking to Roberts manages Helion. So we talked to them about what options were available, and they suggested two options. One is taking a bus offline from the municipal transportation, which we felt wouldn't serve the totality of the community that relies on that. So it wasn't a good option. And the next option was to buy bus passes for students that could be accommodated along that municipal route. So those things are actually, that option is in place now. The next thing we did, or concurrently, is we offered mileage reimbursement for the families that had the means to transport their kids to the schools. We were a little cautious about carpooling because unless they're in a cohort, transporting in carpooling fashion could present an opportunity for COVID spread. So we left that decision up to the parents, but we do provide reimbursement, and those forms and applications are online for the parents to partake in. We continue to monitor how many drivers are in a training program and when they'll come out of the program ready to drive. It's a lean workforce, as I'm sure Rep. Kapela and Rep. Tarnas, in that marketplace. And the standards for a student transport driver are quite high. I talked to a friend of mine that's a fireman, and he looked at it. He did driver training. He said, it's a lot to do, but that's the standard that the Fed provides for us, and it's a good thing. So that's kind of where we are. The curve in the road always to us is if I get a driver that calls in sick tomorrow, I mean, it's so tight, I don't have the capacity, or the bus company doesn't have the capacity to flip a driver in because there's no bench. So that's kind of where we are. Fortunately, when they come out of their quarantine period, there's a degree of immunities that have built up in the person, and we can get them back on the route quickly. We're still searching to pull drivers from the other side of the island, but both sides of the islands, the east and west side, are struggling with driver shortage.
Can I ask a real quick follow-up?
Please.
So it sounds like carpooling is only going to be possible within that student cohort in order to minimize potential spread of COVID. Is that what your strategy is for the schools? Is really to see if the cohort can carpool, because it's going to be a real challenge.
Right. We're also trying to have a discussion with. There's a car company that does van rental when you carpool, so the capacity would be greater. We're also looking at the requirement for transporting students, 12 or 14 passengers is possible without a CDL license. So we're looking at the inventory of vehicles that the DOE has. If we can put that in a pool, we're still working through that. Health and safety is our #1 priority. You also should know that we have an internal guidance that we leave no child on the curb, right? Even if it's, so long there's a seat, we do not want to leave that child on the curb. We reserve the first 2 rows. If the child looks a little under the weather, we make sure that they're masked and they sit in the front seat. When we get to the school, we let them know, can you have this child be accompanied to the health room for just a check? And we go from there. So it's not only the precaution of when they come on the bus, when they get to the school, and we're still looking at 2 or 3 other options to get more seats available in the market.
I appreciate your efforts. I just know there's going to be a real challenge for a lot of our families in my district, Rep. Lowen's district, Rep. Kapela's district, and many other rural districts throughout the state. So keep working on it, and please keep the parents informed because they're going to be scrambling. It's a real stress. Thank you.
Thank you.
Thank you, Chair.
Your representative. Next, we have Rep. Lowen.
Thank you, and thanks everyone from DOE for being here to answer our questions. And I had some similar questions about transportation, but Rep. Tarnas covered that, so I'll move on to my questions about distance learning. I wanted some clarification because I think, Phyllis, maybe you said earlier that there was no waiting list for distance learning, or maybe you were just giving us the numbers, not counting the waiting list. I wasn't quite clear on that because I know there's like the statewide program, and then some individual schools have their own distance learning programs. And in my district, most of the schools that do have distance learning programs, which is not all of them, have waiting lists for their programs. So I guess the question is, have those waiting lists been cleared, or did I misunderstand you earlier? And if not, what are the plans to increase distance learning options?
Thank you. So to clarify, thank you for that, is the waiting list I was speaking about was if a school referred a student to the statewide distance learning program. At one point, we had close to 100 students that were on the waiting list, and that caused some consternation about whether or not they were going to be serviced and by when. And so we worked really hard to reduce that number. We've now cleared that the distance learning list. We also know that schools have been contacted by parents who are asking for distance learning. And just as a reminder is that we know from previous year that while we had to do distance learning with every single student, not all students did well. In fact, there were times when students were absent for multiple days and weeks from engaging with their teacher. And so for that reason, as we opened up this year, our goal was to make sure that there was a seat for every student for in-person learning, because we knew that we would be able to track them that way and be able to give them the services and programs that come from only attending in-person learning. As the request for distance learning came up, what we cautioned was that we would have limited capacity to do that. Some schools would be able to make some offers, complex areas would be able to do something, and we as a state tried to do our part too. We are not that clear at our level about if there's any kind of request at the school level that has not been addressed yet. But I do know that the principals are working with families to vet whether or not that student is going to be able to do well on distance learning, progress on distance learning. So there may be cases where the parent may have made that request, but because of our past experience, we know that it may be a struggle for the student to be able to learn on distance learning. And so I'm not sure what the wait list looks like for schools, but I do know that we have, through our vetted process, we have helped every student that has been referred to us by the schools.
Okay. Yeah, as I understand it, I think there are still students on waiting lists at some of the individual schools. Quick follow-up. Like, of course, we all want the kids to be able to attend school in person safely, but I think especially for children under 12, there's parents that are who can't get vaccinated. There's parents who are concerned. And I think everybody was caught a little bit by surprise by the Delta variant surge and how quickly the numbers increased. And so, it seems like maybe they're starting to come down. It's hard to say yet, but I think it would be important for conversations to be happening within DOT if there is a need to have flexibility or to quickly pivot if cases go up and provide more distance learning options, even though it's not ideal. Is that being discussed? And is there, if something happens where cases really skyrocket up, is there a plan in place?
We have always worked on contingency plans. We never know when we're going to have to deal with a crisis. A crisis is always unpredictable for us, right? So we are always in this mode of here's what we're doing right now. And there's times when, as a leadership team, we talk about fighting for each day, another day of being able to keep our students in-person learning. And the idea is that it takes a lot of, it is challenging, but it takes commitment to do that. But we also know that there are times when we will have to address contingency planning. And so we have been talking about that and getting agreements about how we are going to handle should we have to do certain things like close a classroom or a grade level, just to make sure that if we need to, we can do that.
All right. And then I also heard that if parents enroll their kids in distance learning, then the kids are obligated to stay in distance learning for the entire year. They can't shift back to the classroom, which I sort of understand why, but I also question a little bit the need for some flexibility there. So can you comment on that? And then I'm not asking any further questions.
We did that after many discussion about what the disruption would be with kids jumping back and forth between different modes of learning. And it really was to ensure that as much as possible, we didn't arbitrarily create a disruption to classroom instruction. And as much as possible, try to stabilize the learning environment in protecting in-person learning and the quality of it.
Thank you.
Thank you, Representative.
Sorry, can I just do a follow-up? Sorry, Representative. With our distance learning program, if a student is not attending, is not showing progress, then we are, quote, inviting them back to in-person learning. I just want to make that clear too. So there is a caveat for going back.
Thank you so much. Moving on to Representative Gates.
Thank you, Chair. Thank you all of DOE for being here today to answer our questions. I wanted to, I guess, piggyback off of Rep. Lowen's question regarding distance learning. So in my district, we had a school that experienced high numbers of COVID cases within the school, and the principal, from my understanding, decided to switch from in-person to fully distance. And so is that call based on the principal's recommendation only, or is there DOE influence in making that decision to turn one school from in-person to strictly distance learning?
Thank you, Representative Gates. Might I ask, the school that you're talking about, is that a charter school?
Yes, correct.
The charter schools actually would work together with their charter school boards, and based on that relationship and approvals, that would come from the charter school board, which would be different from the Department of Education.
And what would be the process for DOE schools?
if we needed to transition to a distance learning model, then that discussion would be together with the principal, with the area superintendent, and with the deputy and myself.
Got it. And then in terms of staffing for allowing kids to go distance learning, how is that holding up? And I know we already have a teacher shortage prior to the pandemic, so I can only imagine that has compounded. But from your perspective, what does that look like? And what are the needs, I guess, to have a teacher to fill the position of an online distance learning class?
Currently, yes, Ushijima, do you want to take that? I know that you've been working on the state level distance learning program and hiring teachers there.
Yes, good afternoon, Representative Gates. Thank you for that question. We're very pleased that we were able to hire the teachers that we needed for our state distance learning program. We have 26 teachers and 1 half-time teachers, and the half-time teachers is to work with our kindergarten class that is a little larger than we'd like, and to provide opportunities for those young learners to have some extra support in that class. So, and we're also very grateful because, this has been a team effort across the DOE offices, and we work very closely with our Office of Talent and Management to accomplish this. So thank you very much.
Thank you. And then Chair, I have one final question for DOE. So as of right now, is there, I guess as of right now, all kids that want to participate in distance learning is able to participate in distance learning?
My understanding that I know of, I haven't heard of any individual or student that has not been able to at the state level. I believe we have everybody in. I haven't heard of any at the individual school levels.
So there isn't any restricted access for schools that may not have the capacity to stand things up on their own?
Not that I know of. Do you have any, do you know of any school in particular or any complex area?
Well, yeah, I had a parent, I believe it was from Waianae Intermediate, that was saying they were having trouble with getting their kids on distance learning. I'm not too sure what the specifics were, but it was staff just forwarded me that question to ask. So
okay, thank you very much for that. I'm writing down Waianae Intermediate. I'll be sure to follow up with them.
Okay, thank you so much. Thank you, Chair.
Thank you. Representative Martin, then Vice Chair Kapela, first Superintendent, maybe because that's a recurring theme, you can follow up with the CASs to see if in fact there are any families that want distance learning, because we are hearing about those that wanted it that were not offered. So if you'll please follow up with your CASs to make sure that everyone is taken care of with that.
I will. I'll follow up with that, Chair. Thank you.
Thank you. Rep. Martin.
Thanks, Chair Woodson. Thank you to all the DOE staff for everything you're doing. I know that you are being asked to really go above and beyond this year, and it's appreciated. Yet another hurdle I'd like to put in front of you. What about people in Hawaiian immersion schools that want to do distance learning? Now that we have the statewide English language one, would it be possible to do a Hawaiian immersion version? I have a constituent and some of her kids, especially the younger kids, actually don't speak English that well. And so they cannot easily opt for the English version.
Thank you very much, Representative Martin. I'm going to ask Deputy Unibasami to please address that question. Thank you.
Aloha, Representative Martin. So yes, we are working right now on a Kaiapuni solution. Please know that some of the challenges that we're facing have to do with there's already a shortage of individuals who speak Olelo and also have the pedagogy to be qualified to be a teacher. In Kaiapuni, it takes a specialized expertise in that area. And so what we are doing is at this point in time, there is a commitment to look at what are the types of resources that we can put together to look at what might be available to families who are interested in some kind of distance learning opportunity. It may not look like the state level just because of capacity, but we do not have a solution yet. We just did a discussion with Hawaii principals last night to share some of the ways we're thinking about designing to get their feedback on it. I do believe that there's a meeting with the Hawaiian stakeholders on Saturday. There is a committee that is working on going to be vetting some of our thinking on Saturday. So just know that while we don't have a solution, that we are committed to working on something to be able to offer.
Thank you. Is that meeting on Saturday? Would that be open to?
I don't believe it is open. I would have to check with, because it's not our meeting. We are going to a meeting.
So who is hosting the meeting?
You know what? I will have to look it up. I don't.
Okay, could you follow up with me
Yeah,
separately? Sure. Okay, thank you so much. Aloha.
Mrs. Unabasami, I appreciate the answer, but I think all of us have to do better at making sure that we're staying engaged and connected with all that's happening, because we actually reached out to OHE, the Office of Hawaiian Education, and they said that they actually already have a solution that they're figuring out how to actually implement, and that will be addressed here in short order. And so is that not consistent with what you've been told by your own organization?
We are working with OHE. OHE is the lead on this. They've been doing great work. However, we, in our discussion yesterday, one solution does not necessarily work for all schools and for all families. And that's why I'm not saying that this is the solution. What we found yesterday in listening to our principals is that there is a need for some options and choices. So for that reason, it is not just a one size fits all right now. And then I also have the name, it's Aha Kaulea. For Representative Martin, sorry.
Thank you for that explanation. Okay.
Thank you.
Moving on to Vice Chair Kapela.
Thank you very much, Chair. Thank you, Superintendent. Pediatric cases account for almost a quarter of new COVID cases in our state and nationwide. Moreover, the Hawaii Department of Health has now officially identified multiple clusters in our local schools. What will the DOE, or when will the DOE sign an MOU with HSTA regarding safety protocols to ensure that there is accountability for violations that occur on school campuses? There was an MOU in place, so it has existed before, but it expired with the last superintendent. Every single day, my office is getting more and more information and calls about safety violations from both teachers and parents. And HSTA has also filed a class action grievance because they can't get the DOE to respond to concerns about basic safety measures. Why has this not been done yet? I think that's just my biggest question. A, why hasn't it been done yet? And then it seems like the only reason the department hasn't or doesn't want to be held accountable for basic, it just kind of seems like the department doesn't want to be held accountable for following basic safety guidelines. So I would really ask that you folks make this a top priority, especially since teachers took a pay cut this past year in returning to work in extremely hazardous conditions.
Thank you for that question, Vice Chair. Superintendent, there might be parts of that you can't answer because of collective bargaining statute, but please do your best to answer what parts that you can.
Thank you, Chair. Thank you, Representative Kapela, for the question. I believe when I'm wondering if when you're mentioning the clusters, are you referring to the Department of Health briefing that was recently released?
Yes, sir.
Yeah, I believe that also has been shared in the media. The briefing refers to, my understanding, refers to educational settings, which would include all educational settings, early education, as well as higher education. So as far as we know, in working with the Department of Health, there has been no clusters identified in any of our schools. So I'm not sure really where it may be in a different educational setting, which would also, I believe, include charter schools, and I'm not sure if it includes private though, but definitely
it does.
Okay, and private schools. As far as we know, private schools are not reporting any cases publicly related to their counts. But as far as Department of Education, K-12, there are no identified clusters. And I think that's really important. So I'm glad you raised that question, because as I shared a little bit in the presentation, that we want to be sure that the correct information is being shared out with the community. We do have a website that lists the COVID case count numbers for both students and employees that can be accessed from our website. And so, which it's really important to remember too, that the numbers are not only students, but the numbers also include employees. So it's both numbers on that. And so you can see on that chart, on that graph, individually by school, as well as by the trend that's been there. The bottom graph shows the accumulated numbers, which will actually never go down, but it just gives an indication of the growth over time since July. More accurate perhaps is per school. You can look at individual school graphs, and on that graph, it's the COVID cases reported by the schools, both to us and the Department of Health, since July. And again, employees and students. As far as issues related to HSTA with, I want to be sure that I say what I'm supposed to say and not what I'm not supposed to. So I'm going to actually ask Assistant Superintendent Sean Bacon to address the other concern related to health and safety issues with HSTA. Thank you. AS Bacon.
Good afternoon, Representative Kapela. Thank you for your question. Last year, yes, the department did have an MOU with the HSTA regarding some of our protocols around the COVID-19 pandemic. That MOU did expire at the end of last school year. But what I want people to know at this point right now is we have been actively engaged with the HSTA and the HGEA on monthly meetings regarding COVID-related issues. We've been addressing some of their concerns and keeping them up to date on the concerns that they have been having regarding the COVID-19 safety protocols, anything that involves anything with the COVID-19. At this point right now, I know that there has been a request for us to come back to the bargaining table. That's something that I would rather not have us discuss in this public setting at this point right now. I don't know if that helps answer your question at all, but be willing to take additional questions.
Absolutely. I think it's just having clear clarity on what's going to happen. And that's what I think the MOU is there to provide. Clarity, words are one thing, but having something on paper that really helps guide the safety protocols for teachers and for parents and for administrators is incredibly helpful, especially when we feel like things are changing every single day. One more question, Chair. This is about expanded testing. I know that many of the schools are currently participating in Operation Expanded Testing, as you folks talked about earlier, the DOE's antigen testing program, which is fantastic. How many teachers, school staff, and students have been served by the program so far? And are there communities in which the program still remains unavailable? I've recently gotten a couple of calls from specific schools that have requested to be a part of the program weeks ago, but still have yet to be included. So can you provide a firm deadline on when this program will be available in all schools?
Well, thank you for the question, Representative Kapela. I'm going to ask Deputy Superintendent Unibasami to please respond to your question related to testing. Thank you.
Representative Kapela, if you maybe we can take this offline, is what schools, because I can actually look up and see who's registered, when they registered, and where they are in the queue. I just want to make sure that we're not unfairly representing the data and the process that we're going through. My understanding is that once the conversation between the people who are setting up OET and the school is clear about how many tests they need and what their process is going to be, then it's a matter of ordering it and getting it into their hands. My understanding is it takes several days for it to get to the school, but once the school has the test, they can begin the testing process. And so it would be helpful to know which schools, and if you want to direct chat me and put it in the chat box, I can start looking it up for you and give you information.
Thank you. Chair, one more question.
Go ahead.
Just to follow up to the previous distance learning questions, is the DOE working with their health practitioners to design a specific tiered metric with triggers to guide safety protocols? So including a potential possible return to asynchronous or distance learning. Right now, even with my last question about the MOU, it just kind of seems like there's no clear benchmark for determining when schools should adopt stricter safety protocols. And we really need clear benchmarks so that teachers, parents, and the public know what may be coming so that we can prepare accordingly.
Thank you, Representative Kapela. What we are monitoring together with our partners at the Department of Health is if there is spread or if there are active clusters. And there are numerous factors that we take into account in working with the DOH in monitoring the data. So we are working together with them, and at a point where we would need to transition to another model, we would need to make a determination at that point. But I think with different factors involved related to Delta, it's not as it may not be the same as in prior years last year related to a specific number.
Okay. Thank you, Chair.
Thank you.
Chair. Representative Russo.
Aloha, and thank you for conducting or having this hearing. It's super useful. I think my first question is for AS Ushijima, because it has to do with the direct and the distance learning being offered at the complex level. So the Pineapple Academy is a complex level initiative. And I'm wondering what support you folks are offering to other complexes to do something similar, because I know that there are students from every single elementary school in my district, at least, that are availing themselves of that opportunity. And I think it's really useful. So how are you supporting those complex level efforts?
Aloha, Representative Peruso. Thank you for your question. We have been working with Kaz Davis and his Pineapple Academy team in terms of providing supports and consultation and also learning along with them. And we've also been available to consult with any other complex areas that have indicated interest. So I think when the Lelehua Mililani Wailua complex area initiated their plans, that was done early on, and it was with a more long-term approach, really piloting what might be a possible way to provide learning in a different modality for that certain type of students who might thrive in that environment. So we know that some complex areas, they have been working within their own schools, and we have not imposed or have definite plans to scale up, I guess, to duplicate the model in each complex area. However, we are learning along with them, and they are a great example of what is possible. And even as we've stood up our state distance learning program, we've learned from what they've done, and we continue to have open, regular conversations so that as we look forward to what distance learning might look like in the state of Hawaii, in our public school system, in our complex areas, the hope is that we will continue to be innovative, think about possible designs to meet the needs of our students.
Okay, thank you. I appreciate that. Quick second question. It's my understanding, and I think this might be for, this is for the superintendent. So Superintendent Hayashi. It's my understanding that there are long waiting lists for after-school childcare statewide, and that's having a negative impact on working class families. I know in my community it is. And I understand that you as superintendent can play a role in ameliorating that situation. It seems that you can approve the monthly fee increase for TANF, and then we could use reserve TANF funds to subsidize the increase of fees. So that would really help with A+ labor shortage. And then it's also my understanding that the department can increase the per student costs for the 21st century community learning centers. So I was wondering if you're planning on taking either of those actions.
Thank you for the question, Representative Peruso. I will be turning that question over to A.S. Karatanimura. A.S. Tanimura.
Thank you, Superintendent, and thank you, Representative Peruso. Kara Tanimura for the Office of Strategy, Innovation, and Performance. And yes, our community engagement branch has reached out to the providers to brainstorm and identify some possible solutions. And one of the biggest, I guess, challenges that they have is the competitive salaries of places like Starbucks and other fast food places that would pay more than what we're able to pay. So we are looking at fee increases, as you noted, and with the ESSER 3 funds, we're able to have a little bit more flexibility in addressing some of the labor shortages, and hope that this will attract, retain, and recruit staff for these programs. We also recently, I think it was in August, we released the statewide RFP for out of school time programs. And I believe that will close in early October. And if anyone has questions and would still like to put in a bid for any of the programs, they can contact the community engagement branch by this week, Friday. And then the RFP will close October 4th.
So you're not planning on pursuing either of the strategies I mentioned?
Oh no, we're very open.
So TANF, you're still talking about TANF. Okay, great,
Yes.
thank you.
Thank you, Rep. Kapela.
Thank you.
Or Rep. Peruso. Just as a quick follow-up per that inquiry, our understanding is that that also requires Board of Education approval. Are you able to, when do you foresee that you're going to be able to get that information to the board so they can potentially look at those fee increases?
Sorry. Well, we're going to just look at all of our options and discuss it with the leadership team. We had a leadership team discussion this morning, but I believe, Superintendent, we would probably be coming up with something fairly soon.
Soon defined as when?
Oh.
We do have a board meeting coming up. Actually, the agenda is being set now for the current meeting, but in September. But we do need to get input and for that process. So we're hoping at the October or at the latest November board meeting, but hopefully sooner rather than later.
Thank you so much. Next, we have Rep. Hashimoto.
Thank you, Chair. Thank you, Superintendent, for being here and your leadership team. I think you are definitely trying to lead the Department of Education at a very, very difficult time. And I think it's taking a lot of pivoting. So I commend you on what you've been trying to do. I think we can never stop improving. I think my concern, when I talk to the teachers within my district and I ask them, well, what's your biggest concerns? And I think it's really labor, right? I think it's getting their students to the school. So I had a few more questions about the bus, and I want to pivot then to the in-school labor. But I think, maybe this is for A.S. Tanaka. How are you leveraging some of the contracts? I think the good thing about us that we don't necessarily run the bus system, but it's all contracted out. So if these people, aren't fulfilling their contracts? What leverage do we have them? I know you have the reality of having to make sure that you actually have a driver on a route, but yeah, at some point there has to be some type of penalties, right? That if they're not fulfilling their contract, and maybe we need to go and try and subcontract someone else who will actually fulfill the service, right?
It's an interesting dilemma that we have. We have a limited amount of suppliers in the student transportation arena. Our biggest player is Roberts, who also is involved in the tourism aspect. And they have expressed concerns that they have that kind of shortage in their tourism model. And that tourism model compensates at a different level. So we compete within their own organization. They have some form of competition. Secondly, in recent times, I think last year, there's a discussion of the buses have to be upgraded. They can only have an X amount of years of useful life. And you can imagine what a cost of a bus is and how many they have to replace in their fleet. So I'll give you an example. Total bus drivers at our peak pre-COVID was about 650 bus drivers. So you're talking 650 buses system-wide. To replace that inventory, from a financial standpoint, maybe a little pressing on the company without some longer assurance and maybe an increase in the cost. The challenge we will continue to have is the rotation of drivers, the buses ending in its useful life. And so I can squeeze them on the contract, but the dilemma is if they decide this is not a model that's financially viable for them, they could walk away. I work with a relationship that we're partners in this. It's good for them, it's good for us. You alluded to the fact that if we get into the transportation business, that financial model could be quite large when you're trying to run 650 buses and 650 drivers. So our approach to them is to work with them. We've talked about incentives. They have an incentive for drivers, but understand its implication for every type of labor shortage we have. Are we going to provide an incentive for that? We've had the discussion. It's not off the table, but we want to have a broader discussion how we can help them in different situations. And we're there.
No, and I think, and this is not for you as Tanaka, maybe for the superintendent. I think, a few sessions back, I think we had a very intense discussion about really taking a look at staggered school start times, not only because of the bus situation, but also because of traffic. It's also because of trying to, clogging up our communities at one period of time. So I think, at the time, the department said they needed $250,000 to study the situation. But I think COVID has kind of proven that maybe it's time we revisit that and to really take a look at the staggered school start time. So superintendent, I really hope that, you have a whole bunch of things you have to do, but I hope, this is something that will be top of mind when trying to look at this specific labor situation. I think we kind of anticipated that this would happen with bus routes, because trying to find a bus driver just for a few hours in the morning and the afternoon, we knew all along that it would be difficult. And I think COVID has just exacerbated that situation. So please, superintendent, I hope you will take a look at that. Maybe we will try and pursue that again this session, and and maybe we can find some type of solution to that. I think compounding that as well is the substitute teacher situation. I think I'm talking to a lot of teachers, and maybe even just the teacher situation in general. I heard a few stories of just teachers just kind of saying, I'm done, right? And turning in their keys and walking out because it's just whatever situation. So I guess partly what is the situation with your teacher retention? Because I think that's always been a concern of mine. And I think how many vacancies do we have? And what is the substitute teacher situation at the current time? Because I know there's a shortage, but what are we doing to try and get more substitutes on the line? Because I know a lot of teachers are trying to give up their prep times to be able to substitute. And I know going to the cafeteria and being watched by a big group because we just don't have enough substitutes. I'd just like to get an understanding of what's going on with that.
Thank you for the question, Representative Hashimoto. Before we go to that, I'm going to ask AS Bacon to respond to that. AS Tanaka, did you raised your hand? Do you have something else you wanted to add?
Yes, so Rep. Hashimoto, thank you for bringing that up. The idea is called a coordinated bell schedule. And we were ready to launch in the second half of this year around January, which means changing the arrival and departure times of students so we can get maximum utilization. The bus makes two runs instead of one run. And that has to be done by a complex area because it has to do with just the proximity of all. So we had a coordinated bell schedule ready to go for our largest complex area, the Kapela area. And unfortunately, the bus shortage and the timing didn't work well. And we have to go through to talk to our labor partners because it changes the job schedule for the teachers and the staff at the schools. Now we have taken data that says at the higher grades, starting later actually helps them. They sleep a little longer in the morning. So we have data to make that work. So once we get through some of these other issues, we're ready to launch that program. So be assured that we continue to look for multiple solutions. But thank you for the question.
That's great, Rep. Yes, Tanaka, I really appreciate it. Hopefully, please keep us posted on that. I think a lot of us will be very curious to know if that can be worked out. And I think it really now more than ever, we need to figure out how to make it work, right?
Absolutely, thank you. And like you said, the traffic problem gets exacerbated when we can't use bus transportation. So it's a multiple benefit if we can really get our bus transportation back to pars. Thank you.
Thank you.
Thank you, A.S. Tanaka. A.S. Bacon?
Good afternoon, Rep. Hashimoto. This is Sean Bacon, Assistant Superintendent for OTM. So you did ask some questions about our teacher separation data, also about some information about substitute teachers. So we continuously are recruiting for substitute teachers year round. We did move this past year to an online application to make it a little bit easier for substitute teachers to actually apply into our system and remain in our system. We actually have this year allowing for our substitute teachers to help with the situation. We've done allowing class 1, 2, and 3 subs for all schools this year. So class 1 subs is a high school diploma or higher. We also have a bachelor's degree for class 2 subs, and then class 3 subs are those that have actually completed a state approved teacher education program and are licensed. So we're actually allowing all 3 levels of those to be substitutes in our schools for this year. We have also expanded the way that substitute teachers can actually become part of get into our system, because they do have to go through a substitute teacher certification course. That's also run partly through our community school for adults. There is also now a few different online options for substitute teachers to do this at their own time so that they don't have to do it through the actual community school for adults. So we've been watching those rates also. But many people were thinking that our data was going to show that possibly a lot of teachers were going to be separating due to the pandemic. But basically on our 5-year trend between retirements and separations, it's been staying pretty steady since 2016, 2017 school year. And it's been averaging around 1,100 separations per year. I think last year we saw about 40 more separations than we typically would see on an average school year. Hopefully that helps answer some of your questions. If not, I'm here for additional questions.
Thank you, Chair.
Thank you, Representative. Representative Yamane.
Thank you, Chair. I have two issues I wanted to ask. So I'll give a break to the superintendent. I'll ask Ms. Unibasami, Deputy. Don't worry, Tanaka, I'll get to you after. So Phyllis, real quick, in regards to the distance learning, what is the actual numbers that you guys are doing? And then the question then is, with the actual numbers, is that including those that you guys are finding that are testing positive and then being sent home? What is a number? What are the actual student counts?
So I only have the count for, I believe we only have the count for the state DL. I'm not sure what the count is for distance learning at the school or the complex area level. And I'm looking to Kara Tanamari, if she has that number. She's our data person for distance learning. And then if we're, and then maybe after that, we answer that question, can I clarify what you're asking around impacted by COVID?
Okay.
So Kara, do you have a count on that by any chance?
Just one moment, Deputy. Oh, I'm gonna pass that to AS Ushijima. She has the numbers.
Okay, thank you. Sorry, wrong person.
Thank you, Deputy. So as mentioned earlier, for our state distance learning program, we have 625 students. That's our current count. And as of September 3rd, in our Infinite campus, there's a mechanism where schools are able to indicate which students are on full distance learning. And that number on September 3rd was 9,397.
Okay, so I guess I'm asking them for some clarification. So the 9,000 is those that are on official distance learning, or what does that 9,000 represent?
Though that number represents the students who are on a distance learning program that is virtual. So
Okay.
they are the ones who are not reporting to full in-person learning.
Okay, so it's more than this 600 that you have as DL?
Yes, the 600 some students, they're part of our state distance learning program, but we also have programs that the complex areas have coordinated, or programs at the individual schools that have chosen or were able to provide those programs.
Okay, so because that's a huge difference. Okay, so for all of us, it's 9,000 students currently that have chosen to stay off campus. Is that correct then?
That's yes.
Okay, so when parents make a request to do distance learning, even though that wasn't a priority for the past superintendent, does that add on to the 9,000, or how does that work if moving forward in regards to distance learning?
So this number is based on what the schools input in Infinite Campus. So yes, they are able to update those numbers. And if we have students who are on distance learning who then change their mind to attend full in person, and we've had some of those, then the numbers could also go down.
Okay, so good. Yeah, because I've heard 500 and then I've heard in the thousands. So it's good to clarify. Thank you. Okay.
Yes, thank you.
Okay. Now for AS Tanaka, in regards to the issue of if we suspect a student that might be COVID exposed and is, I guess, currently being tested, or and we're putting them in the so-called quarantine areas. So I have some concerns, not only if they are proven to be positive, are we now putting potential students who in exposed situations in a classroom, and who's monitoring that? Are the teachers and staff then who have to monitor this area also then are in a heightened area? And what type of education are they getting while they're in this so-called quarantine zone waiting for tests, since some tests are not getting reported back to their parents for 16 to 48 hours?
Hello, Rep. Yamani. Good to see you. Before I started, before I started with the DOE, my hair was black like yours, but that's a different subject matter. I would have to defer that to Deputy Unabasami, the protocols that we set up. And isolation is probably not the best word we can choose. We just want to limit their access to the other students to prevent that spread. So it's
I agree with you. I just did hear that some schools are putting all those students in one area, and then so like one classroom or one open area. And so then the question then is, if you're mixing third graders with sixth graders or whatever, how are they getting their age appropriate, grade appropriate education while they're, and what are they doing?
So aloha, Representative. So the moving to an isolated area is really temporary. It's like a child who gets sick. So when a child gets hurt, needs a Band-Aid or ice pack or whatever, they always go to the health room. So students who have symptoms of COVID maybe will come to the health room, but there is an area that is isolated so that the students don't mix. However, it is still supervised. When I visit schools, just from my personal experience, one of the things that I always ask principals to do is show me their protocol for if a student shows up on campus and is exhibiting signs. What is their protocol? So they may have students in an area, but they're also distanced from each other. Some of them have barriers between cots and or chairs. Others have tents or benches that are separated. But they are supervised by an adult, whether it's the school health aide, security, or whoever. There is an adult with them. And when the parents come and pick them up, there's even a protocol for how the parent enters the school and checks the child out. They do not go through the main office and so forth. But that's just a temporary transitioning the student from the school campus back to the home.
Okay.
So I don't want it to sound like, they come every day and they're like in lockup. That is not what I meant to do. I meant to say that as soon as we realize that there is something that symptoms, then there is a process for that. Your second question about what happens at the time that the students are now in quarantine. We do want learning to continue. So there's different options that can be utilized to help students. We have since last year, we have choice boards that are grade level appropriate to the standards, thanks to Terry Ushijima's shop. Teachers have packets that they give to students when parents request homework and or the teacher themselves are going to be out for a while. We also have Google Classroom. We have different ways of helping students while they are in quarantine. And so just know that we are looking at the different ways that schools are responding and making sure that with the types of resources that we have, that every school has a way of supporting students if they are being asked to quarantine and stay home.
Okay, thank you. Thank you, Chair.
Thank you, Mr. Chairman. Next, we have Representative Majority Leader Belatti for a second question.
Thank you. And I put the question in the chat box, and I just want to comment, we've had such great partnerships with all of the healthcare providers and community health centers that have really stepped up and helped with vaccination. So my question largely is, what is the school's plans to have mass vaccination opportunities when the CDC finally clears the vaccine for the elementary school grade levels? Because I think the schools are going to be a great location for those kinds of partnerships so that we can get that large population vaccinated.
Thank you for the question, Majority Leader Belatti. I'm going to ask Deputy Unibasami to take that question. Thank you, Deputy.
So this is really work we're doing behind the scenes right now with DOH. And I want to make sure that you understand, like, this is not just my work. I'm representing the work of many. So we have had several meetings with our complex area superintendents and even with elementary school principals and middle school principals, because and some of our state offices, because one of the things we're tracking is how many students will be eligible for the vaccination should it happen at a certain period of the year, right? Because kids turn eligible, their eligibility age turns on their birth date, right? The second thing is that we want to make sure that, because from our experience in doing employee vaccination and students, older students, that we realize that community-based, right? Near your home, near where you work, we tend to contribute largely to the vaccination rates. And so we know that when it comes to our youngest learners, it's going to be very important to our families that they feel like whoever is caring for their child, whether they're there or they're asking, it's like the flu shots, that somebody knows their child and can care for their child. So we're going to play an important role in this. We have already talked with elementary school principals, shared with them the information. We don't know the launch date because it really is CDC and FDA, right? But we also know from experiences what it's going to take. So we have already, schools have already identified, self-identified and said, we're willing to be a site. We don't know that every school has to do it because some schools are really small and may not have the traffic flow that we need. But DOH already has the schools. There's quite a few that are interested across the islands. And once we get that understanding of what the protocols are going to be, what's the launch date, DOH is already starting to identify providers so that we can match them, right? The second thing is that we also know that, I mean, because we're parents, right? And we know when they were young, we worried about everything. And so we just know that there's going to be some extra communication about making sure trusted people like pediatricians from their community are actually speaking to their parents about the safety, the issues around this, and bringing confidence to are they getting their questions answered? We don't believe we are the credible source of information. It has to be doctors that they know and trust. And so we want to make sure there's a speakers bureau, that there are pediatricians that are speaking in their communities about this. So there's two parts. One is that piece, communication and answering questions, and the other one is the protocols for giving the shots.
Thank you. Thank you, Chair.
Thank you, Majority Leader. Members, any other questions?
Chair, can I ask one more question?
Vice Chair Kapela.
Thank you. This is for Superintendent. Is it true that all schools are being required to perform screener tests at least 3 times this year to evaluate student progress? Additionally, the DOE has been asking about 50 teachers to facilitate the interim Smarter Balance Assessment performance task to evaluate if it's possible to use as a guide for learning loss recovery. This to me marks a really clear break, I think, from the DOE's prior efforts to try and reduce standardized testing in favor of more holistic education opportunities. And having had many conversations now with teachers and with principals, adding something else like this on top of their already full plates really just seems in many ways cruel to do to these educators. I just want to understand, why are you doubling down on standardized testing rather than spending resources on more proven ways to address learning loss recoveries, specifically like after school programming, like Representative Peruso had mentioned earlier, and just ensuring that every single child has access to a qualified teacher. And that to me seems like a much better way of utilizing funding than to spend more money on standardized testing to address learning loss.
Thank you for the question, Representative Kapela. The screener assessments that we are asking schools will be implementing is part of our 3-1-1 effort. And so 3 includes for our student focus, looking at attendance data, looking at academic data, and social and emotional data. And so next one is for our staff well-being. The last one is to ensure that we have for our system. And so what you're referring to in the screening assessments are for the academic and social emotional screeners that we're asking schools to implement. And so that information is really important because as our students are coming back, we need to really assess where they are, get a baseline in terms of where they are, and then schools can then identify working together with teachers what the needs are for our students. And so that will provide us definitely with insight in terms of the kinds of strategies, effective strategies that we'll be able to use in supporting our students. So those 3 screener assessments are in the beginning, in the middle of the year, and at the end of the year to assess our students' growth and the effectiveness of the supports that we're providing for them. I see AS Tanimura also on, and so her office is helping to coordinate that. So AS Tanimura.
Oh, yes. Hello. Thank you, Representative Kapela. Just to clarify, the Smarter Balance assessments for the interim assessments are not required. They are voluntary. It's up to the school as far as the Smarter Balance.
Okay, thank you. It's just that when we spend so much money already on standardized testing, it just seems like right now when we can use that money in other ways to help keep schools safe, I think that might be a better way of keeping our students in the classroom if that's really the big goal of the DOE right now, is making sure they're safe in our classrooms.
Thank you.
Thank you, AS Tanimura. If I can also just follow up with that Representative Kapela, that the screener assessments that we're providing, that we're giving to our students will be taking, they're not standardized assessments. Yeah, they're screening assessments for us to get an indication of where our students are at any particular point in time. That's also very important because schools will be then leveraging our ESSER American Recovery Plan funds to create those plans, both within their schools and within their complex, working together with their complex area superintendents to devise those plans that we can support our students in those areas, attendance and engagement, academics, and social emotional supports. Thank you.
Thank you very much, Chair.
Thank you, Vice Chair. Members, any other questions? Okay, seeing or hearing none, I have a couple of questions. Superintendent, I'm going to ask a couple of questions that haven't yet been asked. Per your accounting system and school absences, is there any delineation being made between students that are missing school because of quarantine and not? And I ask the question because we're getting reports from parents from across the state that in fact they're receiving letters of truancy for their children, and so it's causing additional consternation.
Thank you for the question, Chair. I am going to ask either AS Tanimura or Assistant Superintendent Shaw to help to respond to that question related to attendance.
Okay, good afternoon. I'll take the first part of it. We actually have a cross office, state office work group working together right now to make sure that we have a code in our system, our student information system, to be able to track those that are being, for attendance purposes that are related to COVID, whether if it's quarantine, close contact, or a confirmed case. So we have a follow-up meeting this week, and we will be finalizing that, providing instructions to the schools on how to use that and get it into the system. And then it will be available for reporting. And with that, I'll hand it over to AS Timor.
Yes, and then just as far as Strive High reporting goes, attendance is a part of that federal requirement. So we do want to note for those students who are absent more than 15 days, just so that we know that we can provide them some programmatic support. But it is not meant to be punitive to the school because we understand the situation with the quarantining with COVID.
Does the USED have any leniency on that particular rule as they have been lenient with other provisions that are happening in normal circumstance, not COVID circumstance?
So far, no. It is still a requirement.
There's no guidance from the USED.
No.
And just to build upon that, we know that certain families are also, once there are confirmed cases in the classroom or even in the larger school, that they are making the choice to keep their kids at home. That's their choice. And these parents hopefully are calling in and explaining as to why their kids are absent. And so is that absent considered an excuse or unexcused absence?
Let's see, A.S. Armstrong, would you like to take that question?
Right, and we're putting together, as A.S. Shaw just shared, the guidance for all of the specific scenarios and what constitutes an excused absence, what's an unexcused absence, what will be marked as a quarantine absence. So we're working on that guidance now, and we'll have to look at all of the different scenarios that the schools are facing and have standard language for to address each of those situations.
Okay, thank you for that. And when is that guidance going to be available to the schools?
Well, we are meeting. We do have another meeting this week, and we should be able to finalize everything at that meeting. So I would say within a week, the schools will get the guidance.
Okay, thank you for that information. And I wanted to also drill a little bit further down on the discussion around distance learning. You said that you are formulating contingency plans as it relates to bringing potentially more distance learning capacity online. And I'm wondering, what have the discussions been around the metrics or the trigger mechanism in which the department, in consultation with the Department of Health, has for when you're going to bring more distance learning online? And I asked the question because we can anticipate that as cases increase, that there are going to be more families that do want to partake in that distance learning option. And so when is there going to be a reopener for that discussion, if so?
Chair, thank you for the question. If I can just get some clarity on your question. So you're asking, when will we be allowing additional distance learning slots to be open, whether it be at the school complex area or state, for individuals who are not choosing in-person learning?
Either or, but just to clarify, so at the beginning of the school year, as was discussed, families were given a choice. And we are actually hearing that not all families were given that choice, but most families were given the choice of either attending school in person or if they wanted to do distance learning. However, we know that that year time period perhaps is too long, and it's a difficult discussion to have logistically. But if in case that the COVID cases continue to increase at the rate in which they are, we can anticipate that there are going to be more families that do want to partake in some sort of distance learning option. And so be it at the school level, at the CAS level, or at your OSID system-wide level, what are the trigger mechanisms as to when you would reopen that discussion and allow families to switch to distance learning if they so choose?
Chair, I don't believe that we've identified at this point a trigger for that. We can definitely take a look at what that might be. We are definitely supporting and encouraging full in-person learning for our students, and also considering the fact that we want to be sure that our families and our parents know that looking at the numbers that we have in our schools, they are significantly less than the numbers of COVID cases in the surrounding community. So we want to be sure to get that information out to everyone that perhaps one of the safest places for students to be is in our public schools, because we have those mitigation strategies in place, and our administrators, our teachers, and our employees are all working very hard to provide that safe environment. So we can definitely take a look at it and get that information to you.
I think it would just be helpful in terms of your efforts that if you're thinking about those type of scenarios, because I mean, I don't think it's a stretch to anticipate that, in fact, more families are going to be wanting potentially distance learning options. I mean, we hope that's not the case, but it's at least very possible.
Yes, and we will definitely take a look at that. I think it's really important to also continue to encourage our parents and to share the benefits of in-person learning as much as it is not just about the academics. It definitely is academics, but it's also about the social support that students get while they're in school. It's about having breakfast and lunch and the meals, guidance and counseling and so forth is all really important. I have been getting also email, and individuals have approached me about the both teachers and parents about the importance of in-person. So as much as possible, we do want to encourage parents to continue with that in-person environment because of the many, many benefits for their children.
I wholeheartedly agree with all those variables. Thank you for sharing that. I want to transition to testing, and I appreciate the progression that the Department of Education has had with regards to increasing testing capacity, particularly through your OET system, to which you're offering testing not only at the CAS level, but at many times at each school level. This is specific, of course, for those personnel that are unvaccinated, I know that you're working with the Department of Health. You're actually deferring to the Department of Health as to the frequency of tests that should in fact take place at the school level. Department of Health is deferring to CDC, which outlined a parameter. They use the term regular testing. DOH has defined regular testing as 1 test per week. And again, that's specific to unvaccinated personnel. We appreciate that you're also considering expanding your OET system at a later point for students that otherwise don't have opportunities to get tests for whatever reason. We think that's a healthy discussion to be had also. And we believe that all of this has taken place because we are working in partnership with the Department of Education, and that's having some impact on some of these discussions. But I am concerned that the frequency of testing is still limited. I don't mean to ask a weighted question, but I want to know what your thoughts are as to whether or not you think that testing once per week is sufficient.
Thank you for the question, Chair. Again, we are working in consultation with the Department of Health. And our Board of Education has also made it very clear to us that the subject matter expert when it comes to areas of health is a DOH. And so we, in any decisions that are made related to what you had just shared about, we would need to definitely consult with the Department of Health before making any kind of recommendation or decisions.
And you're consulting with the Department of Health on a normal basis, defined as several times per week?
Yes, well, we are at least once a week. Deputy, I know you've been in communication with them too.
Daily.
Daily, as well as A.S. Armstrong. I know you've also been with your office, has been also in communication with them. Frequency, twice a week, 3 times a week?
Formal meetings or meetings with specific role groups at least twice a week. And there's daily communication with our partners at the Department of Health.
Thank you.
But from your perspective, Superintendent, do you feel that once per week testing is sufficient?
Chair, respectfully, I'm not in a position to make that decision because we need to defer to the Department of Health, and I don't believe that I am qualified to make that recommendation. Very respectfully.
Okay, I can appreciate that. So you are not involved in the Safe Travels program, but that's something, of course, that the Department of Health is intimately involved in. Safe Travels program, for those that are not aware, states that if I need to travel back and forth to and from Maui, which often case I do, before I had to test 48 hours before I can enter onto an airplane. That's still the case as it relates to people coming in from the continent and other areas around the world that they have to test 48 hours before they can enter onto an airplane. And that is because they want to make sure that we're keeping our community members safe. And so if 48 hours is the time frame from the Department of Health as it relates to when they deem is safe for travel to keep all of our communities safe, why then does the Department of Health say that 1 week is sufficient time for our kids, particularly when it comes to those groups of populations of children that do not yet have access to a vaccination because one is not available for them? Did that come into your discussions?
No, Chair, I have not had any discussions related to the safe travel program. And I'm not sure if there are other factors that are involved in that decision as far as the frequency of testing related to safe travel. I'm sorry, I'm not able to answer that because I'm not sure what the requirements are for that or what was involved in that particular decision.
Okay, I appreciate that.
I can follow up though.
Please, within the constructs of DOE operations then, when we are talking about sports and sports activities, they actually have a requirement to be tested twice per week if in fact they are unvaccinated. And so if for our DOE athletes that they have to be tested twice a week, then why is for the larger community that's not also a consistent standard?
I believe, Chair, that the decision related to student athletes, NCAA also had come up with a prioritized list in terms of greater interaction, physical interaction with certain sports, and there's a higher degree of contact with individuals. For example, I'll just take one sport, for example, would be football. And in football, individuals are not masked, while the students on our campuses are, and that's one of our core mitigation strategies. So therefore, for that reason, I believe that the decision for twice a week testing for our student athletes was made, because one of the reasons was for the difference between not masking in a contact sport versus individuals on our campus mask consistently as a core mitigation strategy.
I understand that rationale as it relates to football, but that requirement is blanket, so it applies to other sports like volleyball. Volleyball is comparable to kids playing outside in recess, and yet there's not that standard in place for our kids.
I need to check on that NCAA website, but I believe, if I'm not mistaken, and AS Ushijima, you can jump in too if you like to. I'm not sure if Mr. Fujino is on board on the call, but if I'm not mistaken, I believe volleyball is also considered one of those sports that are higher risk, just for the fact that you are not masked, but yet you are in very close contact with each other, especially if when I watch volleyball. I'm not a volleyball player, but when I watch, if individuals jump up and they're next to each other, just the exhaling and breathing and so forth, that may be also considered a high impact sport.
I appreciate that response, Superintendent. These are hard questions, but I think that we should think more deeply about what level of protection that we do offer, not only our kids, but our teachers. And so because we know that the department right now has several hundreds of millions of dollars that are currently not allocated at the school level or other, would you consider taking some of those resources? And if the department doesn't have the capacity to do double testing, for logistical reasons or other reasons, if in fact you would contract out with some third-party service provider to minimally do some sort of surveillance testing so that we can have 2 layers of protection to make sure that we are maximizing protection for our kids and mitigating the spread of the virus.
Again, with all due respect, Chair, I'm not able to respond to that because we're not the subject matter experts in terms of health-related issues. And I would need to talk with the Department of Health, defer to their guidance related to any kind of testing.
I know that you're having these discussions, Superintendent. I appreciate it. They are not easy conversations to have, but I just want to make sure that we keep some of these situations in front of mind. Lastly, if I can switch to the busing situation, my office has freshly reached out to many of the service providers that are currently operating the routes. And at least some of them have told me that they can increase their capacity to accommodate these routes that are currently not in service due to a lack of CDLs. And so my recommendation is that that situation be revisited, and that you offer some of these routes or all these routes that are currently discontinued to all the service providers to see if some of them can actually take them up. Because what we're hearing also is that some children have not only no access to transportation, they did not have access to distance learning. And so what's happening is 3-4 weeks without schooling, and that should be concerning for all of us.
I see A.S. Tanaka on the call. A.S. Tanaka, would you like to respond to Chair Woodson?
Yes, thank you, Superintendent Chair Woodson. Why don't we do this? We're going to create a log and reach out to these guys on a scheduled basis and see what availability they have to give you the confidence and us going through the process of checking with them on a regular basis, whether it be a call or probably an email to validate our outreach to them. We have talked, my director and administrator of student transportation has constantly called them. We get different stories, but we will create that log and make sure that we're consistently reaching out to them and have those kinds of discussions. Like you said, these are difficult questions, but we're in difficult times, and our continued caring of our students is the #1 priority. So we'll work on that and report back to you, if that's okay.
Thank you.
Thank you.
Okay, members, we're approaching a little over 2 hours. Is there any final questions that anyone has? Seeing none, I want to thank the Department of Education for this opportunity to have a discussion. And Superintendent Hayashi, you just got there to that position, and these plans were already in place. And so you are having to make adjustments on the fly in a historically challenging situation. And so I want you to know that, yes, we're asking tough questions. We're asking questions, though, on behalf of our community members. And in the House, we want to be active. We want to partner with you and make sure that we work towards results so that our community members can feel better and secure about what's happening within our DOE schools, because everything depends upon it. And so with that, I thank you again. I thank all the ASs for being on the call as well. And I thank you very much for all your work. And with that, we are adjourned. Thank you.